This is Joanna. This afternoon, we'd like to just take a few minutes and introduce you to our does and our little baby bucklings. We have 2 of them right now who are available. They're on a shared program with their mama. And so this is Sammy, and Archie is up here checking out Jitterbug. Jitterbug's getting ready to have babies. Well, this afternoon I wanted to talk a little bit about what practices that our renowned veterinary Dr. Kennedy recommends when you have a doe that's kidding. And you know, there's that concern when you're in the heat of the kidding. Has the doe actually got any retained placenta, and what do? So Dr. Kennedy tells us that if your doe is still in the birth process, we want to make sure that all of the babies are delivered. And the only way that you can really do that is to put on a clean set of disposable gloves and go in and feel for them. And it's really important because it's a very painful thing for the does to have this done, and there's a chance of spreading infection. And so we certainly want to be careful with doing this, and only when necessary. But a practice that's important for our doe's health is that if you're going to go in multiple times, or if you just go in once to check for your babies or help reposition them, that you're going to want to insert one 250 milligram terramycin scour tablet. And really, this is a good idea anytime you enter the uterus to assist with birth. And in observing, you're going to want to keep an eye on your doe. Once beyond that point, if you notice that the doe appears to be done kidding, you do not want to enter the uterus unless absolutely necessary. But at that point, you're going to want to inject penicillin, and the dosage that the veterinarian recommended to me is to inject the penicillin at 10 cc's per 100 pounds of weight, and that's sub-Q along the rib cage. Stay away from the area right behind the legs. I know that in the past a lot of us have done that, but there's a lot of tissue damage that can result from giving injections behind the leg. And it's important that if your doe looks to be doing very well and everything's going good, she's eating, she's looking good, then it's okay, and it's good to go ahead and make that penicillin injection. And obviously some, and this is a personal thing of what your experience has shown you, some give a penicillin injection even if they haven't gloved up and gone in to check on their doe. But certainly, if you have to go in to the uterus, you are always going to want to end with giving her terramycin injection. And remember, the last pass that you make inside the uterus to insert one 250 milligram terramycin scour tablet. Now, just a word of caution. And I wondered this in the beginning when I started working with goats. Often they'll have parts of the afterbirth hanging out from the back. So do we pull that off? What do we do with that? does that indicate that there's a problem? Well, actually, no. No, it usually is not an indication of a problem. It's the natural process. But here's the thing to remember. We do not want to pull or attempt to remove the placenta manually. It is going to be expelled in due time. The terramycin scour tablets do seem to be the most effective uterine boluses that are available. Now, if you know of something else, please share that with us. That would be great. Well, we hope that you have enjoyed our visit here at Applejoe Farms, and hopefully this information has been of some help, especially to those who are newer at kidding and or perhaps maybe trying to establish what you will do at kidding time with your does. And this is along the line of best procedures. I hope that you found this helpful. Happy homesteading.